Hi everybody, from the Berrien County, and this is Under Sheriff Chuck Hite. We're going to take off our masks so that you can hear us better. And for those of you that need to read lips, you have that ability. So we've carefully doffed our masks, we've put them on a paper towel so that we are not contaminated the surface. And now going to use that hand sanitizer. Feels better not fogging up your glasses anymore, huh? It's tricky wearing the masks all the time. We are doing that when we are in enclosed public spaces, just as I assume many of you are, in trying to follow that best guidance there on wearing masks and protecting each other. So welcome, thank you for joining us here. This is our Friday update that we've really made kind of a weekly thing here where we can update you as to what's going on here in Berrien County, make sure you have accurate information, have the most up-to-date information, and also have an opportunity to ask some questions. So again, I'm Nikki Britton, I'm the health officer here at the Berrien County Health Department, and I'm joined by Under Sheriff Chuck Hite. All right, sorry about that. We had some technical difficulties here. As you may have noticed, our sound quality is a little bit better, and that's because we got some new hardware here for doing our broadcast. We're really grateful for that. We're working out through some of the kinks. Really appreciate your patience and for joining us on this new video. We should be good to go for the rest of this. If you are experiencing any technical difficulties in hearing us or seeing us, go ahead and comment on the chat. We've got our moderator monitoring that, so we're gonna go ahead and keep going. So as I was mentioning before, we got cut off there. We finally made it to May. Today's May 1st. We're really grateful that we're through that month of April and hopeful for what we might be moving forward, and know there's lots of questions about where we're at. So I wanted to take a minute to just talk through this epi curve with all of you. We've been getting a lot of questions. Have we peaked? Is this over? There's this sense of, is it done? Did we make it to the other side of the curve? And there's still a lot of unknowns, but conceptually what we're talking about here, and going back to March when we first started talking about this in our first Facebook Lives, you could see here that the way we track cases is through an epi curve. So here we're measuring the number of cases, and this is over time. We were expecting that there might be a peak in cases similar to this red line, where it goes up really high, really fast, and then comes back down, with this dotted line being the amount of surge capacity at the hospital. And we were very concerned as a state, as a country, about what was happening if we had more people sick than we could actually care for in our healthcare system. So that's when we started this effort to flatten the curve. How do we get the curve to be below this line? And so what we were aiming for was more like this green line. It may still have the same number of people that become ill, but it's over a prolonged period of time, and the number of people who are ill at any given time can be cared for in the hospital within their capacity. And so where we find ourselves right now is we're below that surge capacity, but whether or not we stay below that capacity depends a lot on us and how we're moving about in the community, what protective measures we're putting in place as we start to do this. It's been wonderful that we've had a lot of things that have been able to help put us under that line, flatten the curve, but we know that a lot of the measures like closing businesses and a lot of other just facilities in our community, that's not sustainable. We can't keep that going forever. So we're trying to monitor how do we reopen things, but still keep us below that surge capacity, make sure we're prolonging out that period of time. So instead of May necessarily being the end of things, it's really the beginning of a new season. And how are we living with COVID-19 in our community? How do we continue to protect our most vulnerable while not exceeding that surge capacity, still trying to minimize the amount of deaths, but we know transmission is going to continue. This virus is going to be with us for a period of time. We really need everybody in the community, or we need a larger percentage of people in the community to be immune. We don't know how many people really have had this in our community. We know asymptomatic spreaders are part of this. So that's where we're at in the curve. That's sort of some of the concept of what we're looking at with May. For those of you who are keeping track of the specifics, our numbers today, we do have 263 new confirmed cases. We have 173 presumed cases. And those are people who have all of the symptoms of COVID-19 and they have a connection to somebody who has that laboratory confirmed test, but they themselves have not been tested. We do have 15 deaths in our community, and 183 people have recovered of those who have had that confirmatory testing. So again, people are getting to the other side of this, they're recovering, and that is good news. All of this data can now be found in a slightly different format. Yesterday, we launched a data dashboard that can be found on the Berrien County Health Department's website. So if you go to www.bchdmi.org/COVID-19, you'll be able to access the dashboard that's updated daily. It's got more information than just those 4 case points. There's a map, there are things there. So I encourage you to check that out and keep an eye on that daily. So Under Sheriff Height, what has been going on from your perspective, and what would you like to share with the public?
Thank you. So on behalf of the county, yesterday the Board of Commissioners authorized Mac Elliott, who's the board chair, to extend the local state of emergency in our county through May 31st. This order was extended to continue the Berrien County Emergency Operations Center to operate and support the Berrien County Health Department and Spectrum Health Lakeland, and to continue to provide vital resources already in place to deal with this pandemic. It's important to have this extension also in place to protect the volunteers that are helping to assist with the efforts of our health partners, such as the health department, and to allow us to continue to acquire the necessary resources we need. As Nikki mentioned, we are continuing to stress the importance of complying with the most recent Stay Home, Stay Safe executive order, which was updated by Governor Whitmer on April 24th. I also want to take this opportunity to express our thanks to those in the community for their efforts they are taking to adhere to the social distancing guidelines and to lessen the exposure to others who may be a carrier for COVID-19. These efforts will continue to help and slow the spread and save lives. We continue to hear from Nikki and our other health experts of the importance of social distancing, and that is really only our best defense right now against this deadly virus. As law enforcement agencies, we've been working with Prosecutor Mike Sepik to attempt to fully understand the executive orders that are out there. We're continuing to educate and warn individuals that we feel are not in compliance with them. I do want to clarify one topic, though, regarding wearing masks when you're entering a food selling establishment or pharmacy. So there was an executive order issued, number 60, which was a day after 59, which is the stay-at-home order, that has some additional protective actions requiring those who are medically able to wear face covering when they go into those 2 businesses. A food selling establishment was defined as a grocery store, convenience store, restaurant that sells groceries or has food available for takeout, and any other business that sells food. Unlike the previous Stay Home, Stay Safe order, this protective action order is not exempt from penalty. It is subject to the misdemeanor if willfully violated. I also want to mention I'm pleased to report that many of our businesses in our area are currently complying or attempting to comply with these orders and have taken additional protective measures to adhere to the social distancing measures outlined in many of the orders that have been issued. We are continuing to request for the public, though, that they read the executive orders and that are also available online, but if you still have questions, to contact Berrien County COVID Information Hotline at 800-815-5485. And the tip form is also available on the Sheriff's Office website at www.bcsheriff.org in order to help keep non-emergency tips from going into the Berrien County 911 Center. We were pleased to see that, as we mentioned about opening back up, we were pleased to see that some of the restrictions were lifted relating to landscaping, outdoor recreation, and other services. We're expecting today for the governor to have written directives regarding allowing residential and commercial construction to resume activities on May 7th. While we understand the need to gradually reopen businesses and services to the public, we must continue to be diligent in maintaining social distancing. We are all in this together, and we appreciate the efforts of the vast majority of the community that are adhering to these protective measures. We know that many of the people are continuing to make sacrifices to help stop the spread of this deadly virus. And I just want to say we're thankful for the partnership with the health department, and they're working with Spectrum Health Lakeland to see 2 entities working so closely together in our county. We are truly blessed.
Yeah, thanks for that update. And with the reopening, and as you said, things are starting to relax, we're starting to see more things open up. It's really important that as we open up, we don't go back to how we were doing business the first week of March. There's going to be health and safety practices that businesses are going to have to implement. We've already seen these implemented with grocery stores and gas stations and all the facilities that have remained open. that will be part of our lived experience as we move about the world and as the range of places we can go continues to open up. And it's really important that we maintain that diligence, because it would be very easy for this green curve to then start to look like that red curve and things start to go up if we're not doing the masking, doing the social distancing, making sure we're still not having close contact with other individuals, really good hand hygiene, all of the things that we've been talking about. We're going to need to continue to do them, just in different settings. So that's really important. As we start talking about this too, I think a lot of people have a lot of questions about testing and what that means, what's our capacity as we start to open things up, who's eligible for testing and how that changes. So over the last couple of weeks, criteria for testing has expanded. We've gotten additional guidance from MDHHS, the state health department, about who should be tested. All of this has the caveat of when capacity allows. And as we've said each week, the capacity for getting the specimen collection kits, as well as the lab capacity to analyze the specimens, that's been increasing. It's been growing. We are very fortunate here in Berrien County. We have more testing available to us than many other communities throughout the state do, but that does not mean that we have limitless resources and that we can test anybody who wants a test. We wish we could get to that point, but we're not there at this point in time, so there still is a bit of a prioritization, and that's going to continue to need to be something we understand as businesses reopen, as employees start reporting to work, but then maybe have symptoms. We're going to have to be figuring out almost on a week-by-week basis how many test kits we have available, what is the testing strategy for our community. It's worth noting that to get testing right now in Berrien County, the two main players that are offering testing is Spectrum Health Lakeland and Intercare. Those facilities do require a doctor's order. So if you are feeling ill, you think you might be experiencing COVID symptoms, might need testing, it's always still a great place to start is to contact the hotline. Spectrum Health has a hotline for virtual screening that you can contact, which can lead to testing. Intercare also has a screening ability as well for you to get that doctor's order in place if you do feel like you need testing. It's also important to remember that testing for an infectious disease is not that similar to, say, a cholesterol test or having your blood pressure checked. With an infectious disease, you might be infected with the virus, but it might be so early in the infection that the test will yield a negative result when you might already be infected and just in that incubation period. So as people have an exposure to a COVID-19 case, and then they do need to seek testing at some point, we ask people and require people to wait at least 4 to 5 days before they get tested, because that's when we'll have a better picture of what's actually going on in their body. You need time for the virus to amplify, to replicate in your body so it can be detected by the testing. At this point in time, we don't have antibody testing. That's something that as a country we're really struggling through, of what to do with antibody tests, how to use them in a population setting. There are a lot of individual-based settings where they're being used, potentially identifying people to donate convalescent plasma, and there's a lot going on in trying to develop and validate the antibody tests. This notion of we're going to just be able to do an antibody test of all 155,000 people in Berrien County, know who's been exposed and who hasn't, and what are levels of herd immunity, we're just not there right now. That's not our reality. It's not feasible right now. So antibody testing is something we're watching. It remains and will remain a tool in a toolbox. It's not going to dominate everything right now. So I think we've run through a lot of the questions. What questions are we seeing on Facebook right now that we can respond to?
So some questions are coming in just about wearing masks, concerns with people not wearing masks when they're out in public, or what should somebody do if they do have trouble breathing? Should they be wearing a mask?
Yes, so we want to firmly encourage you to wear a mask if it's medically appropriate for you. There are some people who have conditions that make wearing a mask not something that's feasible for them. If you are ever experiencing any trouble breathing while wearing a mask, please do not continue to wear that mask. Make sure you're in a safe situation. Take off your mask and don't. Hi everyone, Nikki Britton from the Health Department here. I'm really sorry that we had some technical troubles today. As I mentioned, we've got some new equipment to be able to do our Facebook Live. I hope you were able to hear everything we did say really clearly. We will be back here at 12:30 again next Friday, and we'll have all of the technical bugs worked out so that we can make sure that we get one seamless video for all of you. If you do have questions that you want us to answer, please go ahead and continue to put those in the chats of this video or the other videos that we've posted here today. We'll go ahead and do our best to get those answered. And again, you can call our hotline at any time if you'd like to, 1-800-815-5485, or follow us on Facebook for the latest information. Thank you.